Autism spectrum disorders. There's a video here that's posted on Khan Academy, which will give you an overview of what is an autism spectrum disorder. So it'll give you kind of a start to our discussion here. So the prevalence of autism spectrum disorders in the United States at this point, based on data from 2014 that was published in 2018, is that 1 in 59 children will have an autism spectrum disorder. And to put this into a little bit of perspective, in 2000, it was 1 in 150. When I started in the field, the numbers were much, much lower than they are right now. For reasons that we still have yet to completely figure out, the ratio of males to females is 4 to 1. So for every 4 males that have an autism spectrum disorder, there will be 1 female that has it. About 44% of children who are identified with autism spectrum disorders have average or above average intellectual disability, an IQ greater than 85. The other thing that we're not completely certain of is whether the other group of children that are being identified as having intellectual disabilities are actually truly individuals who do have an intellectual disability, or is their autism spectrum disorder somehow getting in the way of them being able to communicate all the information that they do actually have. So to give you a little bit of a sense about autism spectrum disorders and the ratios between individuals who are white to individuals who are black, or individuals who are white to students who are Hispanic, is that historically the majority of individuals who were diagnosed with autism spectrum disorders tended to be children that were white. This was probably most likely not due to any type of cultural or racial reason, but more to do with access to pediatricians who were able to appropriately diagnose the disorder. So you can see from 2012 to 2014, the numbers of individuals who were diagnosed with autism spectrum disorders who were white really did not change dramatically. But the individuals who were black or Hispanic, it did go up with some significance. And this is probably more than likely due to pediatricians being much more alert and aware, and that all pediatricians are diagnosing better. Some other information that might be interesting to you about autism spectrum disorders is that the actual number of children identified with autism spectrum disorders varies widely from community to community. For example, about 1 in 175 children in certain areas of Alabama in comparison to 1 in 45 children in certain areas of New Jersey. So it depends on what state it is that you're living in. It depends on what area you live in. If you live in a more urban area and compared to a much more rural area, you are potentially more likely to get an autism spectrum diagnosis, more likely to be correctly diagnosed with an autism spectrum disorder, might I say. The other thing that we're finding is that many children with autism spectrum disorders were not diagnosed until after age 4, even though you can diagnose as early as age 2. There's actually research being done now that is starting to notice particular characteristics in children, in infants, and the way that they interact with the environment, the way that they focus on the faces of familiar and unfamiliar individuals, that they can actually predict whether those are children who have an autism diagnosis. So there's really almost no reason for a child to go all the way to age 4, unless, of course, their symptoms are quite subtle. They may not really be noticed until that child gets into a school setting. The other thing that we're noticing is that girls oftentimes are underdiagnosed or diagnosed later, or perhaps misdiagnosed due to the way that their symptoms manifest. Girls are more typical than boys their age to be having social behaviors that seem like they're not terribly bad, and that they have issues more like OCD and eating issues like anorexia. So sometimes those are masking an autism spectrum diagnosis. So here's the IDEA definition of autism spectrum disorders, which IDEA still continues to just use the term autism. Autism means a developmental disability significantly affecting verbal and nonverbal communication and social interaction. Generally, it is evident before age 3, and it adversely affects a child's educational performance. Other characteristics often associated with autism are engagement in repetitive activities and stereotypical movements, resistance to environmental change or change in daily routines, and unusual responses to sensory experiences. You notice the note at the bottom, it says a child who manifests the characteristics of autism after age 3 could be diagnosed as having autism if the criteria above are satisfied. The students that I was referring to earlier that didn't get diagnosed until they were age 4 were probably individuals who, as they took a history from the family, you start to see that there was a pattern of behavior. There were characteristics that were associated with autism, whether they were noticeable to the family, whether perhaps they might have been ignored due to fear or a lack of information. It's a little hard to be certain about, but the symptomology is usually clear before age 3, even if the diagnosis is not there. So here's the thing about autism. This is a really kind of complicated area, and the reason that it is described as an autism spectrum disorder is because there are very wide variations in children who have autism. And people see them as not necessarily being individuals who fit one particular category of the diagnosis, that can go in very significant extremes. You can have a student who doesn't speak at all to a student who has an amazing vocabulary, lots of academic skills, but has some challenges in the social area. So the variation in children is incredibly wide. Thus, the idea of it being a spectrum disorder, that there's a wide spectrum of possibilities. But the thing is, even with students who seem to be what one might be inclined to describe as higher functioning individuals on the autism spectrum, you will notice that they have social interaction challenges, they have communication issues. It may not necessarily be that they don't have a lot of vocabulary, but they may have difficulty communicating some of their feelings. They may have difficulty in give and take aspects of communication. So even though they have a big vocabulary, they may still be having a variety of communication challenges. The other thing that you often find is that you'll see these individuals have very sometimes limited or repetitive behaviors and interests. For children who have potentially more significant levels of autism spectrum disorders, oftentimes you will see a lot of stereotypical behavior, rocking, watching their fingers. They might tap their hand against their ear to get some audio stimulation. They may jump up and down. Younger children, sometimes you'll see them flapping. And interest things may be that a student has some very specific interests, and oftentimes you'll find this is where the communication piece will break down with a student who has a lot of vocabulary, is that they may only want to talk about what it is that they're interested in. They may not be interested in engaging in a conversation with peers about topics that their peers are interested in. They may be interested in giving their peers basically what one might consider a lecture on a particular topic that they are interested in. Sometimes these interests become problematic, that an individual can't move past a particular interest to start gaining skills in other areas. And other times these interests can be kind of shaped into other opportunities. Perhaps as the student gets older, it may even turn into something that they have as a career. So the other thing that we need to make sure that we keep in mind is that every child on the autism spectrum will have kind of their own individual patterns of autism. you'll find that as you get to meet more individuals with autism, that you start to see certain things that kind of tip you off, that you think, I think I've met somebody a little bit like this person before. It reminds me of this other person that I know. And that's not necessarily a bad thing, but the thing that you want to keep in mind is that every child is an individual, and people will say things like, once you've met a person with autism, you've met that person with autism. So you want to keep in mind that they are individuals. The other thing that you may hear folks saying is that some individuals who have autism will actually describe themselves as autistic. And I think that is certainly their prerogative if they want to refer to themselves in non-person first language, but I would strongly encourage you to continue to use person first language. So the Diagnostics and Statistical Manual of the American Psychiatric Association, what's known as the DSM-5, is really the guiding force for a diagnosis of an autism spectrum disorder. It is typically diagnosed by a medical professional, whether it be a child neurologist, a child psychiatrist or psychologist, or a primary care physician. But some things that are part of the DSM-5 diagnosis, which overlap with the IDEA definition, are that we see persistent deficits in social communication and social interaction across multiple contexts. So if you see a student who is able to engage effectively in one situation and then in another situation does not, that may or may not mean that that person is on the autism spectrum. Restricted, repetitive patterns of behavior, interests, or activities. So that you may find that you have a student, a younger student, say in the elementary grades, who only wants to go on the swing at recess and will not go on any other pieces of playground equipment or engage in any other activities during that time. And if they can't get on the swing, they may actually get quite upset about that. You may find that older students have, particular interests that they want to engage with. Many individuals on the autism spectrum are actually very interested in video games, somewhat similar to their same age peers, but that you may find that those are activities that they want to engage in on a almost continual basis, to the point in which they may not be learning about other things. The symptoms must be present in the early developmental period. The IDEA definition says before age 3, and this parallels that. Symptoms cause clinically significant impairment in social, occupational, and other important areas of current functioning. Individuals on the autism spectrum, many of them are very, very intelligent. They have many, many skills, but oftentimes even those individuals who have a lot of skills will have difficulty with social situations. They may have difficulty as they get older and they get out into the workforce, and they may have difficulty with certain kind of day-to-day types of activities. The other thing that we need to keep in mind is that these disturbances are not better explained by intellectual disabilities or some type of global developmental delay. Although in many individuals, in about 66% of individuals on the autism spectrum at current data, also have an intellectual disability, but you will find that their autism spectrum diagnosis is really their primary diagnosis. In order to provide a diagnosis of an autism spectrum disorder from a medical perspective, the individual doing the diagnostics needs to look at a couple of criteria. And the first piece of this is criterion A. And criterion A really looks at the communication piece of it. So you may find that you have students who are on the autism spectrum who have a hard time with this social emotional reciprocity. They may not understand when other people are upset or angry. They may not understand that the child that they have now been telling about the weather for the past 10 minutes has completely and totally disengaged with them. They may not be picking up on the fact that that student does not really want to be talking to them anymore. They oftentimes, in some respects, almost come off as being self-centered or uncaring, And that's really not the case. It's not that they don't care about other people. It's just that you actually have to teach them how to recognize emotions in other individuals. I had the opportunity quite a few years ago to hear Temple Grandin speak. And Temple Grandin is probably one of the most famous individuals on the autism spectrum disorder. She does a lot of public speaking. She is a doctor of animal husbandry at, I believe it's Colorado State University. So she's a very, very bright woman. But she talks about having to actually learn to recognize that someone else was upset. And her cue when someone else is upset is that tears are running down their face. So if you had somebody who was like really sad but not crying, she might not pick up on it right away because she's looking for that cue, that external cue of tears, to recognize that that person is sad. And then at that point, she might say something like, oh, why are you sad? Is there something I can do? Another thing that you'll see that's part of the communication piece is the nonverbal communication. These individuals oftentimes do not recognize all of those like subtle social cues where somebody is kind of like half turning their back from them while they're still talking to them, which should be an indication that that person doesn't want to talk to you anymore. They may not recognize, facial expressions really well. A whole array of nonverbal communication kind of oftentimes gets past them. So they miss a lot of the subtleties of communication. They may have difficulty developing, maintaining, and understanding relationships. They may not understand why someone doesn't want to be their friend. They may not understand how to have a romantic relationship. So these are all things that they may need to learn about, whether it's within the context of the school environment, whether perhaps they get some outside counseling. But building relationships can be very difficult for individuals on the autism spectrum. Oftentimes to other children, they appear disinterested and they look like they don't necessarily want to be somebody's friend. And in all reality, many of them really truly want friends. They just don't quite know how to go about getting them. Another thing that we need to look at is what is called criterion B. So this actually looks at patterns of behavior, the repetitive patterns of behavior, interests, or activities. So you may see an individual who has stereotypical or repetitive motor movements. They may use objects in a particular way, in some sort of self-stimulatory repetitive thing. They may pick up a piece of string and flap it around, or play with their shoelaces, or use other objects in the classroom to gain some type of sensory stimulation. The other thing that you may see as part of this repetitive stereotypical movement is actually repetitions in speech. You see this very frequently with younger children, where many of them can repeat a Disney movie verbatim with all the changes in intonations. They've probably watched some of them hundreds of times. It's a pattern that's called echolalia. So that echolalia may be something from a previous time. It could be something that was said over the breakfast table. It could be a videotape. It could be something that you said to them right then. So you may say to a student, "Good morning, Michael, how are you?" And he may repeat back to you, "Good morning, Michael, how are you?" instead of saying, "Good morning, how are you?" So you may see them repeat things. Another thing that you may see in students on the autism spectrum, which may be kind of your cue as you're in perhaps substituting in a class, so there is a student in there, is an oftentimes inflexible ability to have a routine changed. So they may very much like the schedule that the teacher normally keeps in that classroom. They may think that things have to happen in a very particular order or in a very particular time. So they may believe that on Friday there will always be cheese pizza. And maybe there's something that goes wrong and all the cheese pizza gets rerouted to a different school and something else gets made for Friday at lunch, they could potentially be quite upset about the fact that it's Friday and we should have been having cheese pizza. Where is the cheese pizza? They oftentimes get caught in things where the person who is with them becomes part of their routine. So if a student is working with a particular paraprofessional and that paraprofessional is out sick, they will be potentially, they may be upset or have a difficult time that day because their routine has been broken. So it's really important, I think, with students who have autism spectrum disorders to make sure that they have multiple adults in their life who can be people that they look to for some of the security and safety that they may be getting from one particular paraprofessional. But if that person's not there, you got to make sure they have another way to adjust. They may have, as I mentioned earlier, really restricted, fixated interests that are kind of abnormal. So it may be a reasonable interest for a child of their particular age. Many young children on the autism spectrum are incredibly attached to Thomas the Train. Not quite certain what it is about Thomas the Train, but there is something about Thomas the Train that a lot of younger kids on the spectrum really, really like. But their love for Thomas the Train may go above and beyond the kind of typical love of Thomas the Train that another child their age may have. So they may not be able to kind of move past certain things. They may be very stuck on particular things. They may know details about something that other people have absolutely no idea about. So they may be very, very interested in dinosaurs, and they may have an enormous amount of information about dinosaurs, or they may be very interested in watches and have lots and lots of information about watches, or be very fixated on, you know, people's watches. Every time they see someone, they may want to look at their watch. They may have hyper or hyporeactivity to sensory input, or an unusual interest in sensory aspects of the environment. So some of the things that you may see is students touching things that you might be like, I wonder why they're so interested in touching a particular surface. Or they may overreact to something that does not seem to be anything that needed them to be overreacting to. Many individuals on the autism spectrum seem to be very, very sensitive to noise. They hear things like buzzing in fluorescent bulbs. Fluorescent lights in classrooms are very difficult for many children on the autism spectrum. Some folks will report that they can smell what's being cooked in the cafeteria well before anyone else in the building can smell it. They may actually sometimes underreact to situations. They may have pain that they are not indicating that they have at all. I worked with somebody at one point who had fallen down, and the folks that were with that individual helped him get back up. They were watching him. They didn't see anything that caused him any concern, but he went to the doctor anyways, just to be sure, because there was a little bit of swelling. Doctor didn't think there was anything of concern. For some reason, didn't order an x-ray. As it turned out, this individual had a spiral fracture. He walked around on that leg for about 2 more days before anyone kind of figured out that there was something more going on than a sprain. But he was not giving out very much information at all that he was in as much discomfort as he should have been with a broken bone. So that's criterion B. So the other thing that may happen when you have a student on the autism spectrum is that there may be other things that are accompanying impairments, or what you might hear described as comorbid conditions. So, as I had mentioned earlier, about 66% of individuals on the autism spectrum, given our current ability to measure IQ, are considered to be individuals who also have an intellectual impairment. Many students on the autism spectrum will also have language impairments, whether it's a lack of development of expressive and receptive language, whether it is that they have other things like speech impairments. I had a student that I worked with early in my career who had a very, very high-pitched speaking voice, which would be considered to be a speech impairment because it was an unusual and unexpected pitch to his voice. They may have other medical or genetic conditions. Many individuals on the autism spectrum also have seizure disorders. So you may have a student who has an autism spectrum disorder, also has seizures. They may have other neurodevelopmental, mental, or behavioral disorders. Many of the adults that I've worked with over the years who are on the autism spectrum ultimately also get diagnosed with obsessive compulsive disorder because some of their interests and preoccupations actually become sort of detrimental to their health and well-being. And very unusually and very rarely, you may see a student who actually has catatonia with their autism spectrum disorder. Another piece that comes out of the Diagnostics and Statistics Manual of the American Psychiatric Association, the DSM-5, are severity levels. And the severity levels are actually the new diagnostic criteria's kind of approach to eliminating language such as classic autism, Asperger's disorder, pervasive developmental disorder, not otherwise specified. So this is kind of the way that they have dealt with taking away some of those other categories of autism spectrum disorders, putting all of those folks into one general category, but looking at their severity level, which basically kind of balances with their needs for support. So level 3 are individuals who have very severe deficits. These may be individuals that don't speak at all or have very minimal speech. They may not really interact with other individuals, even as others try to engage with them in some social fashion. They may be completely and totally kind of appear to be withdrawn from that. They may have very, very extreme difficulty with change, to the point in which it could cause incredible levels of upset. So for individuals who have very severe levels of autism spectrum disorders, when you go to teach those individuals something, you want to make sure that the way you taught it is the way you want them to do it forever, because that's probably how they're going to learn it, and they're not going to be able to regroup and change what it is that they've learned to do. Level 2 requires substantial support. Individuals with really severe levels of autism spectrum disorders may not necessarily be in your school system at this point. Those may still be students who are actually outplaced in special programs for folks on the spectrum. Students who require substantial support are probably students that are at your school at this point, potentially in a resource room with some time out in the general education classroom, in the general education classroom, maybe potentially for the majority of the day, but most likely with a paraprofessional support. So these folks also exhibit challenges in social impairments, even with supports. They may not necessarily initiate social interactions, but they will respond when other folks do. They may have things that really get in the way of them learning things or appear to get in the way. You know, their inflexibility, their problems with change, the repetitive things that they do. But you may find that even a student who is engaging in a very repetitive, stereotypical behavior who you think is not paying attention to a lesson may actually be able to engage in that stereotypical behavior and actually gain information from the lesson. They may have periods where they get distressed when they're asked to stop doing something or to change from one thing to another. These are students who oftentimes have a really difficult time with transitions, especially transitions that do not come with appropriate amounts of warning. These may be students that you give them something to do and they don't want to stop until they're finished with it because they see that you have to get to the end of something before you go on to something else. And maybe it's the end of the school day and you want them to stop doing that. They may have a hard time doing that. Level 1, these are the folks who need the least amount of supports. These are individuals who are going to go out into the workforce, they're going to go to college, they're going to do a whole variety of things when they're finished with school. But while they are in a K-12 environment, it's really important that we try to teach them as many things as possible. These are the individuals who oftentimes misinterpret social interactions. They may not necessarily have great friend-making abilities. It may be very important that the teacher in their classroom or the teachers that they see throughout the day try to create opportunities for them to get to know a variety of students in the class so that they have an opportunity, hopefully, to find someone that they have enough interest with that they can make some friends. These individuals also have trouble switching between activities. It's very helpful if you can give them warnings when you're changing things. They may have problems with organization and planning that get kind of in the way of them being independent. So these are students who, for the most part, are probably in all general education classrooms with some level of support. In classes that maybe they have a lot of information about the content, in a class that perhaps they really enjoy, they may need very little support. In a class that they're struggling with, they may need more support. So some comorbid conditions, kind of alluded to this when I was talking about the Diagnostics and Statistical Manual's criterion for autism spectrum disorders. But about 70% of individuals with autism spectrum disorders have another mental disorder, another comorbid mental disorder. And about 40% may have 2 or more. So you may find that a student that you have who's on the autism spectrum also has anxiety, or has sleep problems, or has ADHD. You may find that they have sort of an avoidant restrictive food intake disorder. Many individuals on the autism spectrum are very fussy about things that they eat. Sometimes that gets to the point in which it creates such a significant problem for nutrition that it would actually be considered a mental health issue where they are restricting their food intake. So they could have a potential variety of other things going on. So just because somebody has autism doesn't mean they can't be depressed. So there's a whole array of things that we kind of have to keep an eye out for. So some ideas of things to keep in mind when you have a student who is on the autism spectrum. Some things to kind of think about. Here's some strategies that you could potentially be using. Letting them know in advance when something's going to change. Giving them advanced warning is one of your very best defenses to a problem. So if you know that you are going to be at a conference tomorrow, you may want to make sure that that student knows. For some students, that may mean that you tell them at the end of the day today, and that works great. For another student, it might be that you let their family know and they tell them as they're getting on the bus the following morning that you won't be there. So it's not a surprise that you're gone. Certainly there are things that we can't plan for, but as many things as we can kind of give them advance notice for is really helpful. Many individuals with autism spectrum disorders are very distressed when the fire alarm goes off. So for some students, it may be actually written into their IEPs that we're going to give them a little bit of a warning before the fire alarm goes off. You know, maybe you are given the information that's going to go off at 10:30, and at 10:29 you whisper to that student, we're having a fire drill in a minute. so that they can kind of prepare themselves for it. And maybe they use noise canceling headphones or something. Providing structured activities is really helpful for students, because sometimes if you don't leave them with clear structure to an activity, they won't actually know what to do within that activity. Keeping distractions to a minimum. Teachers who love to over-decorate their classroom are very problematic for many children on the autism spectrum. There's too many things going on in the room. There's too much noise. There's too many things on the walls. So you want to make sure that you keep as many distractions as possible to a minimum. That doesn't mean that you can't hang anything up, but you don't want to hang up every single thing that every single kid did over the course of the school year. Simple, direct instructions, even for a student who you think has great communication skills, the less extra verbiage there is, the better when you're giving an instruction. Giving them time to process that instruction. Making sure that you're consistent. So if you have a particular expectation of that student, that you need to be consistent about carrying through with that expectation. Some students on the autism spectrum will need a positive behavior support plan. So if they have an individualized behavior support plan, you need to make sure that you're following that. Having a peer who is maybe their recess buddy or their lunch buddy or their study buddy could be really helpful for them. Giving them visual cues as well as auditory cues. So you may give a student a written schedule or a picture schedule to go along with other information that you're providing verbally. Predictable routines as much as possible. I would encourage you to make the predictability the schedule. So if you need to change the schedule, it's still predictable that I have a schedule, but you may have needed to eliminate the last 2 periods of the day because we're having an assembly. I see that on my schedule. What's predictable to me is a schedule. So there it is, and maybe I'll be good with that. But if I find out that we're skipping the last 2 periods of the day when we're just about to that time, may not necessarily be really helpful for me if I were a child on the autism spectrum. Picture schedules, especially for those folks that don't read. Some students may be using an augmentative communication device. Many younger children on the autism spectrum who have not yet developed really good verbal skills benefit greatly from some type of communication system. A sensory menu, giving that student different things to do that help engage their sensory system. It may mean that that student has a piece of Velcro on the edge of their desk. It could be that they have one of those therapy bands around the legs of their chair. It could be that they have silly putty that they engage with. So things that allow them opportunities to use some of their sensory needs, to get those sensory needs met within the context of something that might be appropriate for the classroom is really good. Teaching them some type of stress reduction activity. Teaching them some kind of relaxation technique, or to have them do some simple mindfulness practices, simple meditation practices. Those can be really helpful for them. Causes of autism spectrum disorder. This part gets kind of tricky because at this point it's not completely clear why individuals have autism spectrum disorders. But let's put it this way, it's not linked to one direct cause. It's clear that there's a hereditary connection. You may find that you have a student on the autism spectrum and then find out that they have one or more siblings that also are on the spectrum. So clearly there is some type of hereditary thing going on here. There seem to be multiple genes involved, basically creating sort of multiple causes for autism spectrum disorders. Much like what we see with intellectual disabilities, where a student may have an intellectual disability because they have Down syndrome, another student may have an intellectual disability because they were exposed to lead paint, another student may have an intellectual disability because they have Fragile X syndrome. So they all have an intellectual disability, but it came from multiple reasons. The same thing seems to be the case with individuals on the autism spectrum. There seem to be multiple causes for students to actually have autism. So there seem to be multiple genes involved. There's structural differences and brain growth differences that have been found with individuals on the autism spectrum. Those are not consistent across every single individual, but they seem to be kind of a piece of the puzzle. And one other piece that is still probably the one that has the least definitive information is a belief that there is some environmental toxicity that is causing individuals to have autism spectrum disorders. So, treatment. There's no cure for autism. So there's no magic pill, there's no magic treatment. There are many treatments that will help individuals on the autism spectrum live full and potentially independent lives, to help them gain skills that they need, but they will always be an individual with autism. What they will ultimately be is an individual successfully living with autism. So some treatment options that we already know exist, and some treatment options that have a fair amount of research behind them. One of them is applied behavioral analysis. I think many of you have probably heard of ABA therapy, or the student has an ABA therapist or a behavior therapist that works with them and supports them during the day. Applied behavior analysis is based on the principles of basic principles that came from Skinner originally, the idea that we have antecedents, behaviors, and consequences. So you work from a very behavioral perspective. Other things that folks might be working on is building social skills. There's programs that might be used with younger children. There's a program called Floor Time, where you basically kind of allow that child to play with whatever it is that they're going to play with, and then you build your interactions around that. Teach is a program that comes out of the University of North Carolina at Chapel Hill. It provides a structure. There's a lot of scheduling and organizational things that go along with that. You may see some parents using biological treatments. You may have a student who is getting vitamins or is on a very specific diet. Those things are things that I think are still out there to be proven with the research. You may find that you have a student on the autism spectrum whose family has chosen to put them on a lactose-free, gluten-free, casein-free diet, which basically means they can have no dairy and probably almost no carbohydrates. So if you know a student on the autism spectrum who has some very limited food interests, you can imagine that taking all of those kinds of things out will oftentimes create a very limited amount of food. But when you start looking at pulling some of those things out, one of the things that you actually end up doing is you don't eat any processed food. So the fact that the family might be feeding the child ultimately a clean diet may not necessarily be a bad thing, but sometimes the diet gets a little complicated and a little restrictive, and sometimes not necessarily to the individual's taste. Some students with autism spectrum disorders may be on medication. If you have a student who has a comorbid condition of attention deficit hyperactivity disorder, they may be receiving medication for that. If you have a student who has very severe obsessive compulsive disorder, they may be receiving a medication for that. The medications that you'll see students on the autism spectrum getting are medications that are dealing more with symptoms. They are certainly not addressing autism directly. Speech and language therapy is incredibly useful and important for students on the autism spectrum, not only to build vocabulary and to work on speech sounds and speech production, but also to work on the communication piece of language. Communication-wise, you may see students using a couple of different things. One thing that you might see is something called a PEC system, which is a picture exchange communication system, which the premise of PECs is really the exchange part of communication, so that you are actually making sure that you are engaging in an exchange with your communication partner. PEC systems might be pictures that are Velcroed to a board that a student hands to somebody. It could be used on an iPad with some type of voice output. Facilitated communication is basically assisted typing. This was a system that was out there supporting folks' communication. For a long time, it kind of fell out of favor. It seems to be regaining some interest. The challenge with facilitated communication is that in order to teach the individual to type using a keyboard or a computer or whatever device they happen to be using, typically it starts with some kind of hand over hand with an adult. So there's obviously some question of whether that person is communicating independently or whether the adult is somehow influencing what they're communicating. If they get to the point where no one is touching them and they're typing completely independently, that's great. But if there's still somebody kind of holding onto their hand, it becomes a challenge to be certain that that's their communication and not someone else's. Assistive technology devices, some things that you saw in the communication lecture, things like voice output communication devices are incredibly helpful for many individuals on the autism spectrum. So here's a picture of some PECs systems. You can see an individual using a PEC system at a fast food restaurant. So they're handing the pictures to the person behind the counter. On the far left-hand lower side, you can see what some of the pictures look like. The pictures that are used in PEC system typically come from a program made by Mayer and Johnson. That seems to be sort of the standard PECs pictures that folks use. But it can be a really complicated system. It can be very, very simple, like the one up on the top left, where the child only has 5 things to pick from. So as the student builds their vocabulary, builds their sophistication with communication, the system gets more and more complicated. The last thing I want to talk about is sensory integration therapies. For many individuals on the autism spectrum, they have some sensory challenges. So sensory integration therapy can be very helpful in helping them interact more effectively with the environment. So sometimes things like deep pressure massage might be used to help a student calm and relax. You may see an occupational therapist doing some of those things with a student. So there's a variety of possibilities of sensory things that could be done with students as well to kind of help them manage the volume of sensory information that one gets on a daily basis.